In our Health Watch, when people think of hip problems, they may automatically assume that they only affect the elderly. But did you know that there's a condition that's fairly common in young women? It's called hip dysplasia. And Skyridge Medical Center has a new hip preservation program aimed to help these younger patients. So here to tell us a little bit more about that is orthopedic surgeon Dr. Mike Ellman. Thanks so much for your time today. I appreciate it.
Thanks, Dominic. Thanks for having me. Pleasure to be here.
Well, let's start with the basics. What exactly, well, first off, am I saying it right? And what is hip dysplasia?
You are saying it right. It is hip dysplasia. Hip dysplasia is actually the leading cause of early arthritis in young women under the age of 50. And anatomically, when we think about it, hip is a ball and socket joint. Round ball should live in a round socket. You should have, when our musculoskeletal system's developing, you want that socket to form directly over the ball. And the problem is in hip dysplasia, when we're developing, that sometimes doesn't happen. It's too shallow of a socket. It's not a big enough roof over our head. And it leads to this concept called edge loading, where we put too much stress on the edge of that acetabulum. And the labrum, which is a little gummy worm, it's a ring of cartilage that lives around that socket, peels off the bone because it can't handle the stress with increased activities over time. Labrum can tear. Once the labrum tears, the cartilage can start to degenerate and tear as well, and that's the concept of arthritis, and so that's what we're trying to prevent.
Great job of explaining it for people like myself. So not good. So how do you treat this?
Yeah, so good question. So, for patients with mild dysplasia and mild symptoms, they really don't have any pain. There's a healthy population out there. If I were to x-ray 100 people off the street, probably 15 of them may have a dysplastic hip. So a lot of them we're not treating, right? That's part of the problem. But once they start to have pain, then we can kind of go down different pathways. We can start with conservative treatment, trying to get our patients into physical therapy, strengthen the muscles around the hip to help stabilize them. For patients with more severe issues, though, that's where surgery comes into play. And what we offer at Skyridge and with the International Center for Hip Preservation is pretty unique. We're able to treat a lot of pathology in one surgical setting with skilled surgeons, focusing on both the soft tissue, meaning the labrum and the labral tear that comes with dysplasia, as well as a bony procedure to cut the pelvis and reorient the socket and provide a normal structure for our young patients.
And why is this so important to catch and also treat?
Yeah, good question. So, from a quality of life standpoint, the goal of surgery is short term, right? We're trying to improve pain, we're trying to improve function, we're trying to improve quality of life and get these young athletes back to the sports that they love to do. A lot of these patients are gymnasts and dancers. A lot of them are hockey players or soccer players. We're trying to get them back to what they love, but probably even more important than that is we're trying to preserve the lifespan of your hip for as long as possible. And we can theoretically alter the natural history of this process. We know dysplasia leads to early arthritis. If we can get to it early enough, then theoretically, we're going to be able to prevent the arthritic process from happening in the future, and that patient may never need a hip replacement in the future.
Dr. Ellman, thank you so much for your time. We appreciate it.
Absolutely. Thanks for having me.
All right. Take care, and don't forget, you can check out all of our health interviews anytime on cbscolorado.com.